morning, everyone, and thank you for joining. I will allow a few minutes as everybody joins with their audio. It's our pleasure and our honor to have very respectful guests speaking today, but I will give a few seconds just to make sure everybody gets connected so we can enjoy our session. We will be back very shortly. If there's any questions, you can privately chat, leave your message in the chat or the Q&A, and we will get to those at the end of the session as time permits, but we will follow up with each and every one of you. So just a few seconds as I see the attendees number is growing there. I just wanted to make sure everybody gets connected with their audio. All right, I think we're set to go. Ladies and gentlemen, friends, board members, colleagues, fellow case managers, and care staff, welcome here with us today celebrating National Nursing Week 2024, Changing Lives, Shaping Tomorrow, as well as celebrating Indigenous Nurses Day today. And a special welcome to our program manager, Rola El-Mubader, our executive director, Ruth Lee, our Chief of Nursing and Professional Practice and Assistant Deputy Minister for the Province of Ontario, Dr. Karima Velji, and our respectful speakers, Dr. Edward Cruz and Mark Ravoso. My name is Bessie Nasiopoulos, and I'm privileged to be here with all of you today as an IEN myself, Case Manager and Professional Development Lead, and want to let you know how proud and honored we are here at Care Centre to launch National Nursing Week celebrations with all of you. Before we get started, we would like to take a minute and acknowledge the land we are meeting from today. The land we are standing on today is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chepway, and the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit and the Williams Treaties, signed with multiple Mississaugas and Chepway bands. We are all treaty people. Many of us have come here as settlers, immigrants, newcomers in this generation or generations past. We also acknowledge those of us who came here involuntarily as part of the transatlantic slave trade and honor and pay tribute to the ancestors of African origin and descent. We are mindful of broken covenants, and we strive to make this right with the land and with each other. Now we will request our distinguished Executive Director, Dr. Ruth Lee, to welcome you all. Dr. Ruth Lee is the Executive Director of Care Centre for Internationally Educated Nurses. She is an Associate Clinical Professor at McMaster University School of Nursing, where she's a faculty member of the graduate program. Ruth was awarded a Lifetime Achievement Award by the Registered Nurses Association of Ontario in 2018 for her outstanding contributions to the nursing profession. Ruth, you always give us your best by sharing your expertise and knowledge in every way possible to help us all. We are privileged to have you as our Executive Director, passionately showing us the way to support and inspire our IENs, following our values and mission, and hence, changing lives and shaping tomorrow. Ruth, the floor is yours.
Well, Bessie, I'm humbled by your intro. Certainly, I don't expect this. I don't give you this script, so that is, it means so much to me. So I'm very happy this week that we come together to celebrate National Nursing Week. And I do have a short message on the Care Centre website, so I don't want to waste your time. I encourage you to have a look at it and read it. But today, I can tell you I'm so happy and humble to introduce three leaders to you, and they make all the difference. And they are the symbol of hope to all of us, particularly to the international educated nurses community. I'd like to introduce Dr. Karima Velji, who is a healthcare leader with a proven track record in fostering the engagement of the patient and system partners to drive innovative models of care, integrating research and care to drive mixed practice, and creating cultures to unleash the potential of high-performing teams to achieve stellar results. She has implemented innovative health human resources solutions within these models of care to ensure optimal scope of practice of all clinicians. So a lot of her achievement is well known as our chief nurse of the province, but I'm very privileged to have the time that I spent with Karima personally as advanced practice nurses right back in our days at UHN. And I can tell you, with all her credentials, with all her achievements in her heart, I'm just speaking from what I have seen, Karima, that your heart are with the patients. Your heart are with people. And that's how you spend all these years as advanced practice nurses. And it's this experience, I'm convinced, that make you the chief nurse you are today, that you are a truly caring person. Particularly very special to the IEN community is that you yourself is an immigrant, and you have lived through those hardships, and you share the IEN struggles and live it with that lived experience. So as you know, Karima's responsibility is pretty big, looking after not just nurses, but also the healthcare system into professional practice as a whole. So she also have course appointments. I will congratulate those universities that have the privilege have Karima as part of their faculty, including University of Toronto, University of Western Ontario, University of Ontario Technology, and also Miss Nipissing University. So she have won multiple distinguished alumni awards. So I'm sure that you will check her out after I tell you how impressed I am and how humble I am and how happy I am to have the privilege to call Karima my colleague and friend, and also a great supporter to internationally educated nurses. So Karima, we look forward to your remarks to kick off Nursing Week celebration for us. Thank you.
Well, good morning, everyone. The privilege actually is mine. I have to say, this is my kickoff event for Nursing Week. You can imagine it's back to back to back until we finish Friday. So this is how this is my start of my Nursing Week with these remarks. And I can't tell you how fitting it is for me to start here. Because I'll tell you about the HHR strategy quickly in Ontario. This is one of our 4 pillars. The focus on international nurses and expediting pathways to registration, it's my favorite. It's the pillar I'm most proud about. I care most about it because it's very important to me that all of us live our true potential. And the system needs us. The system needs everyone who can be a nurse to be a nurse in Ontario. And in fact, anywhere. Anywhere in the world. As you know, HHR has become the #1 focus. Everything depends on it. Even if when we try to build something new, a new hospital or a new clinic or a new long-term care bed, you can't activate that capacity if you don't have health human resources, because healthcare is a human endeavor. It's all human care. So we absolutely need you, and I strongly personally believe we should all be living our true potential, basically, in the system. Quickly, to tell you about the HHR strategy in Ontario, we have a very robust health human resource strategy. Although my title has the word nursing in it, the division I lead is a nursing and professional practice division at the ministry. Everything HHR lives and breathes under that a division, basically. So the focus on the 26 regulated healthcare professions, but also unregulated healthcare professions like PSWs. All of that. It's a very integrated approach to health human resources, which is how it should be. Because team is the name of the game. Team care is our answer. A lot of our answer out of the dilemmas that we find ourselves in for health human resources. Our strategy is exactly pinned on what Ruth just said. When you have a crisis or an urgent situation like the world does now with regards to health human resources, you can cower and die and keep on talking about the world is falling and the sky is falling and everything is bad and we are burned and we can all die and go home. Or we say, in every crisis and urgency, there are doors that open that don't open otherwise. And the job of leaders is to see those doors and walk through them. In crisis lies the opportunity for change. And we've moved through the doors and really activated a very robust HHR strategy in Ontario. It has 4 pillars. I'll quickly tell you what they are. There is a big education expansion underway for nursing. We have activated in 2 years 3,000 net new nursing education seats in Ontario and 150 nurse practitioner seats. The whole idea here being our number one focus should be about growing our own domestic workforce. While we ensure people who are here, like me, like you, who are immigrants to Canada, also live their true potential. But we can't take our eyes away from the domestic creation of a workforce, because I worry when countries only depend on international practitioners to fill their HHR needs. Both have to be an area of focus. So big education expansion underway. The first cohort from that expansion is going to graduate this year. So we are going to start to see the infusion of nurses from that education expansion. The second pillar is scope of practice expansion. And you've seen a lot of movement in scope of practice. Again, my passion for people living their true potential, no matter who they are. They could be a midwife. There could be a pharmacist. It doesn't matter who you are. You have a right to live to the top of your licensed practice. So we've touched many, many professions with scope of practice enhancements. For example, you've seen the minor ailment program take place, the pharmacy minor ailment program, where if you have minor ailments, you can now walk into a pharmacy, get your minor ailment, like a pink eye, for example, assessed, and then the pharmacy can prescribe you the medication that you need, and off you go. You don't have to make an appointment, sit in someone's office, wait for an appointment, not get an appointment, not able to find your doctor. Call a pharmacist and they'll care for your minor ailments. Similarly, we've done a big scope of practice lift for nursing. So we've done RPN initiation, we've done nurse practitioner scope of practice enhancements. But the thing I really wanted to highlight today is finally, after 12 years of pushing from outside, we finally birthed RN prescribing in Ontario, a game changer. Majority of the people who touch patient care in Ontario and anywhere in the world are registered nurses. So imagine if registered nurses work to their top scope of practice, the magic we would create for the patients we serve is enormous, enormous potential. So RN prescribing is now live in Ontario starting December of last year, which is amazing. Third pillar is where you and I live and breathe, which is the pillar that is focused on expediting pathways of registration for international and interjurisdictional nurses. On the interjurisdictional side, we are the first province that has gone live with as of right. As of right means a move towards national licensure for nursing. If you're a Canadian nurse, work in Ontario. You don't have to go through a big re-registration process in order to start working. So we are the first province that has gone live with as of right. But most importantly, we have, for the last 2 years, removed 22 barriers to practice or to registration for international nurses. And I hope your colleagues feel that, because we see that in the numbers, of course, but we are registering international nurses who have been caught in the pathways of the college faster. Should be even faster, but it's faster than it ever was. So we are moving in the right direction without going and doing any government missions to anywhere. So as a government, so far we've held to the position where we will not go and steal anyone's health human resource in the world. We won't do it. But if a nurse from the Philippines or India or Brazil wants to come to Ontario and they are stuck and wait and wait and wait for re-registration, we are removing all those barriers out. And please look at the consultation the college is doing currently with regards to education equivalence. The desire is there are 18,000 people still waiting to be registered at the College of Nurses. It's a sin that those nurses are not in the workplace working because we have a shortage. I want them in the system. Simple. So the college is trying to move now in the direction where it's saying, you know what? If you're a nurse from the Philippines or India and you graduated from a baccalaureate nursing program, if you're good enough for the Philippines, you'll be good enough for Ontario. Let's not put more requirements for you to come and start practicing in Ontario, other than one requirement, which is there will be a course that you have to participate in online called, which allows you to just familiarize yourself with the healthcare system in Ontario and how the healthcare system works in Ontario. So you can ease into Ontario more easily and more smoothly. The last pillar is retention and distribution. We have many, many programs in that pillar. To give you an example, our supervised practice program, SPEP, our community commitment program, CCPN, our extern program. There are no shortages. There are over 20 programs that sit in that pillar that are trying to add HHR in the system today while we create the capacity for tomorrow. So all in all, you can have a very good strategy, but is it working? You always have to ask yourself and measure, are things working in a very quantitative way, objectively? And I really am a big believer of measurement. You have to measure your success because you won't know otherwise if you have to change your course or change your strategy. I'm so proud to say, I think our strategy is working. And I'm so gratified by it because I've only been in the role 18 months. It feels like 18 years because of the level of hours of work you have to put into making these results come about. And it's not only my efforts, every part of the system is working very hard to create these numbers. So I'm very proud to share with you that in the last 2 years, we have had a historical registration of new nurses in Ontario. No other province has seen what we are seeing. So last year we registered, there were 15,000 plus new registrations. This year, and these are not my data, these are College of Nurses data, just go to their website. They upload their data every month. This year, 18,000 plus. New registrations in Ontario. It's amazing. The best news of all is half of those numbers of each of those years are international nurses. And the time to reduce the time to register nurses in Ontario has also decreased year over year significantly. So we are graduating and registering people very faster than we have in the past. As I said, it's a very amazing accomplishment. I have to give all the credit to the College of Nurses for pushing it and for organizations like you for supporting and pushing the system in the right direction. But finally, our numbers are moving in the direction we should move them. And as I said, once this education equivalent matter is implemented in Ontario, there's a potential, imagine, to introduce 18,000 nurses in Ontario. That takes care more than takes care of the shortage. That's phenomenal, folks. I also received data last week from just unsolicited people sent me some data. And I wanted to do some myth busting with this data because when you hear in the media, the voices that speak for nursing I have to say, I'm getting upset now because the voice continues to be the sky is falling. And in fact, the sky has stopped falling. It was falling at one point in time during the pandemic and after. But we have to let the data say the story, basically. So one of the things you will hear consistently in the media is nursing is not an attractive profession. People don't want to enter this profession anymore. So I'm giving you data from the Council of Universities. This is Steve Orsini, Ruth, who sent me this information. I didn't even ask him for it. So he said to me, Karima, did you know that in 2023, there were 11,504 applications to nursing schools. When we filled all the seats, we filled 3,935 seats. In Ontario, look at how many candidates, almost 8,000 people who applied to be a nurse in Ontario. This is university data. And I'm trying to look for the college data, which is, I'm hoping will tell the similar story. 34.2% acceptance rate is what we had in Ontario. We turned away almost 65% of nursing applicants. Not to say I want to turn applicants away, but I'm saying it's an attractive profession. Stop saying people don't want to enter nursing anymore. No, they do. All data shows us we have more applicants than we have seats. This is after we've expanded all the seats in Ontario. So that's a great news story. CNO data. So the ones that I just cited for you certainly come from the College of Nurses. But one of the IEN data, they were saying the annual number of new registrants have grown by 55% between 2020 and 2023. But the IEN number has grown by 240%. Think, these are registration by the College of Nurses. Phenomenal, phenomenal. And the last thing I wanted to share with you is data that comes to us from the Ontario Hospital Association. So these are hospital data. This is not the case for all sectors. There are sectors like long-term care, home care, where we still feel the pain of vacancies. But in hospitals, we finally started to turn the tide. Our vacancies for the first time in 3 years have started to drop in Ontario. So last year, our vacancy was 11%. This year, 7.27%. That's huge, folks. A whole system moving to reduce its vacancies. Turnover decreasing from 14.6% to 10.3%. Resignations decreasing from 9.8% to 7.4%. And there are many other data, so I won't bore you with that, but I just wanted to do some myth busting. We have an attractive profession. People want to come to it. People have started to stay in it in the hospital setting in Ontario. More work to be done for home care and long-term care and so on, because other sectors suffer more. And there are regions like the North that need more attention. But overall, I think we started to turn the tide basically in the right direction. We really went through a tough patch. Because 15 years ago, when we were predicting shortages, which happened just before the pandemic, we didn't do much about it. Years of not doing a lot of correction to our HHR got us to the place we came to just before the pandemic, and the pandemic blew it open. But now we've started to turn the corner, and we should celebrate. We should celebrate that success together. And the best success for me is the path that has opened and will continue to open for international nurses. I'm so proud of each one of you. Mark, congratulations on your wonderful award. You are the #1 nurse, the hero, basically. So proud of you. And I'm sorry, Edward and Mark, I can't stay for your talk because I have to run to my other event, but I do wish you all the best and success. in all your career. And Ruth, to your organization, CARE, just congratulations. You're on the right side of values in the work that you do. So proud of you.
So my heartfelt thank you and congratulations to you as well, Karima. You have made history for the province. You cite those numbers, and as we know, over the pandemic years, the whole world's airport come to a halt. So people ask me, where do they come from? I tell them they've been with us. The IENs been with us for all this time. And it take a leader like yourself, Karima, to change this, that allow them the opportunity to use their talents that we have wronged them, if you ask me, that we have not allowed them to contribute. So unfortunately, it takes a crisis to produce this opportunity, but we need to sustain this opportunity. We cannot go back to the old days anymore. And I trust that under your leadership, this will never go back. Another thing that out of this opportunity, I also see some potential issues, and we are seeing it at Care Center, is the integration process. We've been toughing the seed, we call the IENs, the tough seed that come to this land. They need nutrients, they need the right kind of soil, they need the right kind of sunshine and water. And I think we owe it to all of them. We, as Canadians, we owe it to the world that we are able to have this wonderful talent to come to us, that we need to nurture them. And that's one thing that at Care Center, we are committed to help employers to sustain them and to support them to transition and integrate into the health system. So we are here contributing as much as we can, and hearing the direction that you have provided today, it absolutely make my day. That's the energy that I personally very, very much appreciate it. I'm sure I can speak on behalf of the IEN community. Maybe Edward and Mark will comment on that when they present. So again, I know you're so busy today and the week. So thank you, and thank you, Karima. It's wonderful to have a friend and a colleague and a nurse like you to drive this health human resources agenda. Thank you, and have a wonderful day.
Thank you for your kind words. Take care. Happy Nursing Week, everyone.
Thank you.
Yeah. Happy Nursing Week, Dr. Farji. Thank you so much.
Yeah.
Take care.
Okay, Bessie, so I think we can share the message of Dr. Lee Chapman as well as the team guests, and then we can, I will then introduce Edward and Mark.
Every day, Canada's nurses provide essential and compassionate care to us and our loved ones in our toughest moments. During National Nursing Week, let's come together to celebrate nurses, acknowledge their skills and competencies, and thank them for their invaluable contributions to our health and well-being. The theme of this year's National Nursing Week is Changing Lives, Shaping Tomorrow. While nurses help save and change lives every day, they also have an influence in shaping our health system for the future. As Chief Nursing Officer, I've had the privilege of meeting nurses in every province and territory in Canada. They need to know that we support them and their well-being for the future. That is why I worked with our nursing community to develop a retention toolkit created by and for nurses. The toolkit is a resource for employers aimed at enhancing nurses' current working conditions. I am proud to be part of the Government of Canada's efforts committed to strengthening Canada's healthcare system and support nurses and other health professionals who keep it running every day. I know how hard nurses work to provide care for their patients, families, and communities. On behalf of the Government of Canada, thank you, nurses, and happy Nursing Week.
Okay, now we can hear from the President of the Canadian Nurses Association, Mr. Tim Guest. So
Hello, I'm Tim Guest. I am a registered nurse, and I'm the CEO of the Canadian Nurses Association. I'm pleased to be able to speak to you today to wish you all a happy National Nursing Week. I'm speaking to you from Mi'kma'ki, the unceded and traditional territory of the Mi'kmaq people. And I make this acknowledgement with the recognition that it must come with real action towards real change that honors Indigenous peoples past and present, their culture, their language, and their traditional healing practices. CNA itself is on a journey to reconciliation through the efforts of a reconciliation plan that is currently in development. CNA is Canada's national nursing professional organization, leading the development of healthy public policy across Canada. We speak on behalf of Canada's 466,000 regulated nurses, as well as nursing students and retired nurses across all 13 provinces and territories. And we're the voice nationally representing the nursing profession as a whole across sectors and across all domains of practice, and have been since 1908. As the national voice of nursing in Canada, we act in the public interest for Canadian nursing and nurses, providing national and international leadership in nursing and health. We advocate for a publicly funded not-for-profit health system. We advance nursing excellence and positive health outcomes, and we promote profession-led regulation. Nursing is too important, too valuable, and too expansive to be left like a rudderless ship with no one at the wheel. CNA helps steer and develop the discipline of nursing for all nurses. We are a leader in health policy, and we are consistently ranked in the top tier of health lobbyists in Ottawa. We develop, share, and mobilize evidence to inform better health and healthcare policy development that benefits individuals, communities, organizations, and systems. We aim to be the federal government's go-to source for informed nursing and healthcare policy advice. We are the only pan-Canadian association that has the mandate to monitor, guard, and advance the nursing profession as a whole. We lead initiatives that bring nurses, other healthcare professionals, employers, and governments together to discuss challenges and develop innovative solutions. This National Nursing Week, we will celebrate Indigenous Nurses Day on May the 6th and International Nurses Day on May the 12th. Our theme this year is Changing Lives, Shaping Tomorrow. The theme recognizes the contributions of the tremendous impact that nurses have on individuals, communities, and the future of healthcare. To me, the theme recognizes the professionalism, knowledge, skills, and dedication each and every one of us contributes in the impact we have on the health of our nation and the healthcare system itself. Nurses play a crucial role in directly impacting the lives of patients. Through their care, compassion, and expertise, they contribute to positive changes in the health and well-being of individuals. Nurses also advocate for their patients, ensuring they receive the best possible care and support. This advocacy can bring about transformative changes in people's lives. Nurses are at the forefront of healthcare innovation, contributing to advancements in treatments, technologies, and patient care practices. Their commitment to learning and adapting helps shape the future of healthcare. Canada is a country that has a rich history, from the Indigenous communities that have made this land home for thousands of years to the people from many countries around the world that have come to make Canada home. We believe nurses have the right to choose where they live and practice. I hope you are finding Canada to be a welcoming place to be, and I hope you are feeling welcomed as internationally educated nursing professionals. I hope you will consider membership in CNA and adding your valuable perspectives to our national association. And you can check out our website at www.cna-aiic. I wish you well in your career here in Canada. Happy National Nursing Week.
Okay, thank you, everybody. I'm so pleased that we have the two leaders in nursing share the message with us today. But today, it just warms my heart to see that I have the privilege to introduce to you two shining stars in the international educated nurse community. Someone who I truly admire, Dr. Edward Cruz. Dr. Cruz, as I said, sometimes we only see the flowers. We don't see how the flower get to bloom. And Edward is one classic example that he's a role model for all of us. The struggle that he have as an international educated nurses, working, not just getting his credentials, but working and then subsequently get his PhD in the Philippines. And he is, again, another success story, having a doctorate degree from another country than Canada, but get into a major university in Ontario, and the work he have done along the way and now. And very proud to learn. I'm particularly proud to learn, Edward, that you are tenure professor now at University of Windsor. So just want people to know there's hope. As much as we read in the literature and his stories and all that, you are one classic example, Edward, of what a star can shine and shine on others. So I think that's something that I'm very, very proud of Edward, is that he's not just, very successful. He worked very hard, but he also empower those come after him and making sure that they don't suffer. I'm sorry, Edward, to use the word suffer, but I know, because I know you for all these years, I know you did suffer along the journey, and to minimize those suffering or get rid of those suffering and sustain our success. So I'm very privileged to have you as our first co-keynote speaker to kick off the Nursing Week celebration for us. So Edward, for those of you who do not know, Dr. Edward Cruz is an international educator nurse from the Philippines, and he's current and associate professor in the Faculty of Nursing at the University of Windsor in Windsor, Ontario. His program of research focuses on social care, health, human resources, interprofessional education and collaboration, and nursing education. So you know that he's going to share his experience and also his research at his talk to us today. And I can assure you, you only have a taste of it. We will make sure that it will come back to do webinars and presentations for you. So just take note that you are just having appetizer, okay? And after that, I'm again very, very happy to share with you the rising star. He's already a star, but he also a rising star, Mark Anthony Govoso, RN, BSCN, winning the Nursing Hero first place in the hospital news. Mark brings with him 16 years of clinical nursing experience, and he's currently working as an RN in general internal medicine and in the vascular access team. He has completed his clinical educator certificate from Michener Institute of Education at University Health Network, and he is the president of the Integrated Filipino Canadian Nurses Association and member of the Canadian Vascular Access Association. But of course, he's a very loved, proud family member of Care Center for Internationally Educated Nurses. So I will suggest that we welcome both of them. So after Edward did his presentation, that Mark will follow. So the mic's all yours, Edward.
Thank you very much, Dr. Ruth Lee. That was a very kind introduction. I'll just share my screen. Can you see my screen now? Thank you very much.
Yes.
Thank you. Good morning, everyone. I bring greetings from Windsor, Ontario, the traditional territory of the Three Fires Confederacy of First Nations, comprised of the Ojibwa, the Odawa, and the Potawatomi. I would like to thank Care Center for this opportunity to participate in Care Center's Nursing Week celebration to share my team's findings for our study on the employment trajectory of Philippine educated nurses in Ontario. I would also like to acknowledge my colleague and co-investigator, Dr. Christopher Romero, who is a Filipino-Canadian scholar here at the University of Windsor and an assistant professor in the Department of Psychology at the University of Windsor. And this is our agenda for today, briefly. I would like to acknowledge that this project is funded through an Insight Development Grant from the Social Sciences and Humanities Research Council. So let's dive into today's topic. Filipinos are among the fastest visible minority fastest growing visible minority groups in Canada. And between 2011 and 2016, the Philippines was the top source country for immigrants who landed in this country. Latest data from Statistics Canada released in 2023 indicated that there were approximately 960,000 Canadians with Filipino roots who call Canada home. Early reports of Filipino immigration to Canada began as early as 1861, with Benjamin Flores being Canada's first recorded Filipino immigrant. Whereas Filipinos arriving in Canada from the 50s to the early 70s were mostly white-collar professionals, the subsequent wave of Filipino immigrants from the late 70s to the first decade of the 21st century saw the arrival of mostly working-class immigrant women, which was an outcome of Canada's migrant worker schemes. For example, Canada's live-in caregiver program facilitated the arrival of migrant workers to Canada. Unfortunately, while this program provided immigrant professionals an opportunity to become permanent residents, after 2 years of hard labor, precarious immigration status, and low income, an overwhelming majority of these individuals remained as nannies or moved on to unskilled employment. Those who chose to remain as nannies summarized their journey in the following words, according to Pratt. From RN to RN, from registered nurse in the Philippines to registered nanny in Canada. The Organization for Economic Cooperation and Development suggested that labor market discrimination based on social differences and various forms of exclusionary measures remain a serious issue amongst its member states. In Canada, it has been documented in the literature that IENs experience various forms of barriers in re-entering their profession. A situation that we find particularly challenging for Filipinos is the visible minority label ascribed to all persons of color other than Indigenous persons. The issue with the term visible minority is that it hyper-visibilizes and homogenizes these individuals. In addition, this has created a discourse that minimizes the broader Filipino experience, including the non-recognition of the political and economic challenges they confront in Canada. Despite the large number of highly educated immigrant professionals from the Philippines in general, and the great number of Philippine-educated nurses working in Canada's healthcare system, there has been limited research examining the employment trajectories and labor outcomes of this group of professionals. In fact, in the last report from the CIHI, Canadian Institute for Health Information, it indicated that for so many years, up until 2022, which was the basis for the report, the Philippines has remained the top source country for regulated, internationally educated nurses in Canada. In 2022, there were approximately 8,700 RNs in Canada who were educated in the Philippines, and another 4,000 who were registered as practical nurses. A key phenomenon that seems to unfold from education, workplace, and professional spheres is that the supports and resources being made available to these nurses are meant, in part, to Canadianize, retrain, and make normal these IENs. By comparison, Pollock, in studying internationally educated teachers in Ontario, suggested that the initiatives and programs being put in place to support these immigrant professionals are based on the premise that the problem lies with the teachers themselves, ignoring inherent systemic barriers within the educational system. This seems to highlight the prevailing view that immigrant professionals, notably those from developing countries like the Philippines, have knowledge and skills deficits. It is therefore important to understand IEN's workplace transitioning experiences within Canada's healthcare system as an exemplar for immigrant professionals from the Philippines, as well as IENs in Canada. This research is based on Goffman's stigma theory and Malaizes and coworkers transitions theory. Goffman's stigma theory recognizes the way by which society emphasizes otherness and categorizes persons that contributes to an individual's social identity. Goffman explored the way by which society emphasizes otherness, categorizes persons that contribute to an individual's social identity, and views this other as not quite human. Transitions theory, on the other hand, has been used in nursing and nursing education to investigate situational transitions in education and practice. Dr. Malaise and her co-investigators suggest that when an individual transitions to a new role, they experience a change in role relationships, expectations, or abilities. IENs were educated and trained in a different country or jurisdiction where social and cultural norms, as well as practice expectations, differ from those of the receiving country. Therefore, it may be anticipated that they will experience changes in the way they will perform their new role. Stigma theory contributes to the personal, community, and societal conditions identified in transitions theory that determine an individual's ability to transition to the workplace. This study that I'm presenting is part of a bigger mixed method study. We sought to interview Philippine educated nurses as well as Filipino Canadian nurses who were educated in Canada. They need to be working either as RN, practical nurse, nurse practitioner, or in any other field of healthcare or non-healthcare roles as well. Qualitative data was obtained through in-depth, semi-structured participant interviews that were audio recorded, transcribed, and subsequently managed using Atlas TI. And we used Brown and Clark's thematic analysis as our framework for analysis. I also wanted to highlight that we did get ethics clearance from the University of Windsor Research Ethics Board. So the data that I'm presenting today is based on 15 Philippine educated nurses working as registered nurses, 5 Philippine educated nurses working as RPNs, and 5 Philippine educated nurses working in another field of healthcare. Interviews ranged from 40 minutes to 2 hours. Some were conducted in English and or Filipino. And so these were the emerging themes from the interviews that we gathered. The adversity and workplace challenges, which was further subdivided into 4 sub-themes: preparing for work and the role of bridging programs or transition programs, microaggression, stereotyping, discrimination, and racism, and planning for the future. Let's look at some of these themes more closely. So in terms of adversity and workplace challenges, some of the IENs we interviewed shared this. Being a family person, I want also to reunify with my family, but here in Ontario, yes, we can do that, but I cannot get them here with a salary of just a PSW, or else we are going to suffer financially. And this is from a 34-year-old male nurse, master's prepared, and was working as a personal support worker during the time of the interview and on a temporary work permit. Another nurse, participant 36, said, I don't know how to write, honestly, how to improve my CV. So like some people are laughing because I put my picture in there, I put my address in there, I put my birthday on there, like the usual, you know, the Filipino resume or CV. And participant 36 is a 37-year-old male nurse working as an RN in a medical unit. Participant 6 is a 55-year-old female who completed her doctorate in nursing practice. At the time of the interview said, I was down in the dumps, you know, you knew, referring to me. You're new, you have nothing, I had zero, I didn't know what to do. And then working with different cultures. Participant 1 had this to say, I was definitely overwhelmed because working with different cultures, it's already a lot to take in. Participant 18, 43-year-old female who was working as a nurse educator said, I'm always going to be fish out of water, being that like where I am located in this city, it's mostly white community. So I think I'm always going to be like different from other people here. And there were also reports of unfair labor practices, and this was mostly from Philippine educated nurses who were on temporary work permit. Participant 2 is a 37-year-old female who was working as a PSW, said, honestly, I'm a little bit frustrated and sad. In what way? Because back home, we're nurses there. I have a lot of problem. First, my employer abused me, and that's why I moved to a different city. Too much work, overwork. I mean, they don't pay me the right salary. Overtime work, no pay. Holiday, no pay. And sometimes I even work on Saturdays and Sundays. Participant 11 is a 42-year-old female, also working as who was working as a caregiver, said, I'm not happy right now with my employer because I'm underpaid, but I have no choice but to continue because it's hard to find another employer. I don't want to skip having some employer to another, and it will be the cause of delay in my permanent residency application. And then there were challenges related to adjusting to Canadian workplace culture. Participant 6 was who you met earlier, said, a lot of challenges. And I would say that the challenges were more like, I don't know what I was doing. I'm just going to highlight that. I didn't know what I was doing. I knew the technical part of it, the book part of it, but I didn't know the practical part of it. And then the next theme, the role of bridging and transition education. Participant 10 is a 39-year-old female who completed her master's degree in nursing in Canada and working at a post-secondary institution, said, I think it helped me to get to know Canadian healthcare landscape. Participant 15 is a 36-year-old male working as an RN in OR, said, it helped me to get a better understanding of what Canadian nursing is, to be honest. So it's really far different from what we're doing in the Philippines. So all those bridging courses, all the learnings, all the schools, I gained a lot from those, from the current job that I've been doing right now. So it made everything a lot easier for me. And the third theme that emerged was microaggression, stereotyping, discrimination, and racism. Participant 14 is a 49-year-old female working as an RN in her organization's nursing resource team, said, it's just that patients sometimes. Sometimes when they see you, before you even speak, they will say, do you know how to speak English? Or because of your color, some of the white people don't want a nurse that is brown. Participant 35 is a 38-year-old male nurse working on a medical unit, said, there was one patient, he told me, can you get a white nurse for me? Participant 24 is a 38-year-old female who did some bridging education and working as an RN in primary healthcare, said, she assumed immediately that I got my permanent residency through my nanny visa because I'm Filipina. Participant 28 is a 40-year-old male working as an RN in mental health, said, there was one older nurse who kept on asking me like, are you from that town that the mail order brides are from? And basically she got the idea from the reality show. 90-day fiance, and she basically like classifies everybody from our country to be like mail order bride or being or like service workers, things like that. The last theme that emerges, planning for the future. Participant 15 is a 36-year-old male working as an RN in OR said, I wanted to be an instructor for OR nurses. That's one of my goals because my focus for my master's is leadership and teaching. So I also wanted to teach, maybe not as a professor in a huge university or college, but just as an instructor for perioperative nursing, more related to my job. And participant 7, 43-year-old male working as a manager at a long-term care facility said, I want to see change. I have to be on top of things. So that's the place where I should be if I want to see change. Participant 33 is participant 23 is a 33-year-old female working as an RN in OR said, I wanted to make change. When I left the Philippines, I was the head nurse in OR. So I can see that, of course, I have a lot of things to learn here. So I guess I can do that. I just really wanted to prove them that we can do it. Note that these are just our preliminary findings. We've since interviewed about 16 more participants, mostly Philippine educated nurses. And so that may change the themes. Filipino nurses who volunteered to be interviewed in this study encountered different forms of challenges as they attempted to begin their lives in Canada, to become nurses again. At least prior to or until the beginning of the pandemic, many found the registration requirements and processes confusing and onerous. And as like what Dr. Ruth Lee said earlier, this has resulted in many IENs, not just Philippine educated nurses, suffer. Participants in this study reported unfamiliarity with the socio-cultural context and workplace norms and practices as among the challenges they faced. Nurses who were on a temporary work permit faced increased employment precarity and exploitation. For those of you who may not know, what happens is for-profit organizations contract with recruitment agencies, and these recruitment agencies were paid, I think, about $5,000 to recruit Filipino nurses from outside of Canada. And apart from the contractual fee that they receive from the organization, they also charge the equivalent of $5,000 to these Filipino nurses. Almost half of the participants interviewed undertook some form of transition or bridging education. Based on the interviews from these nurses, they reported that bridging or transition courses or programs helped them gain a better understanding of the standards of practice and role expectations for nurses, as well as Canada's healthcare landscape. Experiences of microaggression, stereotyping, and discrimination and racism were raised by many of our participants. It is, however, interesting to note that some participants hesitated to share these experiences. This may be related to the Filipinos' cultural value of pakikisama, roughly translating to getting along with others in English, or the sense of religiosity, ipagpas sa Diyos na lang, or leave everything to God. Many of our participants indicated no desire to pursue leadership roles or to advance in their careers. This seems to align with the Filipinos' general approach to life, which is that of acceptance. Bahala na, or come what may, captures the strong belief among many Filipinos that whatever may happen is a part of God's will. In contrast, those who have undertaken some form of bridging or further education verbalize an aspiration to assume leadership and management roles in the future or to advance their nursing careers. Again, I would like to highlight that these are just preliminary findings. And before I conclude, I just wanted to acknowledge, first and foremost, Care Center for IENs for their huge help in promoting this study. to their members, the Registered Practical Nurses Association of Ontario, the Integrated Filipino Canadian Nurses Association for their help with participant recruitment, and the College of Nurses of Ontario for providing the list of Filipino nurses to whom we sent our recruitment flyer. And these are just some of my references. And that's all from me. Thank you very much.
Thank you very much, Edward. In the interest of time, I just like to get Mark to share his presentation and focusing on mentorship and so on, which is so important to groom the next generation of IEN success story. I've been calling Mark the hero, so you are, but I'm glad that you're going to share some of your story of success and words of encouragement. It's heartbreaking, Edward, to hear those findings. And as you said, it's not the IEN from the Philippines, but many also. So we have to absolutely change that. There's no reason for that, right? Because as Canadian, if you look at the charter of Canada, this is not what Canadians are about. Canada welcome the world, and we owe it to the world to nurture those precious resources. So Mark, without further ado, would you please start your presentation? Thank you.
Thank you so much, Dr. Ruth, Dr. Edward, Rolla, and Bessie. So honored and privileged to do this presentation for all IENs in Canada, specifically in Ontario. And I'll be sharing my screen. So honestly, this presentation will be illustrating or demonstrating on like an emerging leader like me, how I inspire other IENs, because I myself as an IEN struggled a lot here in Canada, but I transform those struggles into success and inspiring other IENs to do the same. So in this presentation, Shaping the Future of IENs Through Peer Mentorship and Collaboration, this is like my motivation to become like an agent or like a change agent, especially to be like an inspiration to all international educated nurses here in Canada. But how can I be a change agent myself? So first, like I just ask myself, what matters to me? Those things that like I ask myself, what matters to me, like leads me to like something, like that will motivate me and finding myself to commit myself into something that will inspire and motivate others. So shaping the future of IEN through peer mentorship and collaboration. This webinar will discuss how the organizations like IFCNA are making a significant impact in IEN's journey to success, specifically at Filipino Canadian Nurses Association, and how we transform the lives and shape the future of internationally educated nurses. This webinar also aims to illustrate how peer mentorship and collaboration with other organizations and government agencies create waves of change in shaping the future of IENs in Canada. So what will be discussed? So there are a lot of common challenges of IENs in nursing registration process in Canada, specifically in Ontario. Most IENs knows that these challenges and barriers are like for everyone, like we struggled and we faced these challenges. And the role of mentorship, like it helped me like to gain the success and to achieve my license here in Canada. And most importantly, the importance of collaboration, partnership in an organization, especially in a non-profit organization when I'm leading the Integrated Filipino Canadian Nurses Association. So who we are? So the Integrated Filipino-Canadian Nurses Association is founded in 2019 by Mr. Austin Gaki, a nurse from Scarborough Health Network. The IFCNA is a registered nonprofit organization. Each aim to create an excellent atmosphere that fosters unity among Filipino-Canadian nursing graduates and their associate members in helping internationally educated nurse IENs who want to practice here in Canada. So I want you to see this illustration or image. This is like what I want the world to see, and I want this picture like to keep this spirit alive here in Canada. I know most of the Filipinos will try to relate, or can relate to this images, because this bayanihan culture, the Filipino word bayanihan, is derived from the word bayani, or a hero. It is a cultural concept that motivates people to come together to help those who are in need without expecting anything in return. So I'm gonna go back to the previous slides. Um, this this bayanihan is a collective effort to achieve a goal for a greater good. So this culture is characterized by cooperation, collaboration, and mutual support among members of the community. And we want this bayanihan spirit or bayanihan culture. We want to keep this alive here in Canada, especially here among the IENs. Because in the Philippines, the bayanihan culture is often demonstrated by helping one another in times of need. And here in Canada, there's a lot of challenges here in Canada, but you're not alone. The IEN community and other organization and government agency are willing to help for you to achieve all the success that you deserve here in Canada. And our aim and objective at IFCNA is to keep this bayanihan alive and to help one another and share the kindness to other people. So this is our bayanihan diagram at IFCNA. So some of our members are composed of three different pathways, and we consider this house that we carry on our shoulders our challenges toward nursing registration in Canada. So we are composed of landed immigrants who came here in Canada to federal skilled workers. I myself came here as a federal skilled worker together with my family, and some of them with the increasing number of international students, and the temporary workers who are those who are came here as live-in caregiver or home support worker. And I want to show to you that like an inspiration of 2021 data from the Fair Registration Practices Report, that Philippines, that there's like a total number of registered CNO members in the year 2021, and the Philippines is the topmost country where these individuals gained their education, and followed by other countries. And still, the Philippines is the top source of IENs. So this success of the 8,193 in 2021, but there are still IENs who are still struggle and facing a lot of challenges. And what are those challenges that we usually face? And I know everyone, majority of IENs can relate to those challenges and barriers. So what are those challenges to nursing registration for IENs? There's like timely information, credential assessment, obtaining documents, and language requirements, and especially the nursing registration costs. And the last step is the nursing registration exam. So for the timely information, some of the IENs lack of accurate information prior to migration. This is very serious, serious about when coming to Canada, you have to be prepared and getting all the accurate information prior to your migration. And some of them have been incorrectly advised or have assumed that they will have no problem finding a job once migrated because of their score on the point system. Because nowadays, through express entry, and if you get like a highest score, and you think that you're gonna get you're not gonna have a problem when you like landed here in Canada, but no. What are the strategies? The strategies that we can help IENs is through the PASS, or the pre-arrival support and services by CARE. So lately, when I learned all the services that I can share with other IEN members, especially those like outside Canada, and they're planning to come to Canada, and I find that this PASS or pre-arrival support will definitely help IENs to prepare themselves before coming to Canada. So I just also thankful and grateful for the care center, because I share this one to IEN community, and it helped a lot for them to get more accurate information, sharing information with them before coming to Canada, to lessen the time spent from arrival up to getting the job that they want here in Canada. And also, like, I was very thankful because Dr. Ruth and the care team grant my request to have like a session, like information dedicated to IFCNA for our members to get the accurate information. And lastly, we are also doing our own info session to guide and assist the IENs to their Canadian pathway here in Canada. The credential assessment. Um, the credential assessment, we all know that the IENs who wish to practice their profession in Canada must have first their credential verified in their education compared to Canadian nursing practice competency by the National Nursing Assessment Services. So also, like, through giving information to IEN, we she shared like the what are the things they need to to prepare, and what are those like regulatory bodies that they have to comply with all the documents. And also, we at IFCNA, we also do some roundtable discussions with all parliamentarians to discuss what are the barriers of IENs. Why are some are like having delays, or some of them are like not motivated enough to pursue their nursing career here in Canada. So to discuss, and to give our recommendation to further to recognize our credentials when we come here in Canada. And we found out also, like, it's very helpful and beneficial for Filipino IENs, because lately or recently, the Philippine government uh, release this credential recognition in like a site for the Filipino before coming here to Canada, to help them to navigate the nursing registration process. And by this information, sharing of information, that we can lessen the time spent from arrival and until you get your license and eventually landed to your job that you want. Obtaining documents. So some of the IENs are unaware of the requirements of becoming registered as nurses. Some of them are unable to obtain records from country of origin. The family members or friends are not available locally to expedite the process. And what are the strategies that we could help, like here at IFCNA? So we do some of the information sharing. So recently, we have a meeting with the Professional Regulation Commission, like in the Philippines, to discuss the matters and to discuss what are the causes of delays of our IEN registration here in Canada. So we discussed that there are some like causes of their delays, like wrong information, sending the wrong documents, like on both ends. So we discussed like what would be the best recommendation to streamline the process, and we ended up like the Philippine government is very supportive to help us to streamline this process. I think they're planning to do the online or the documents that no need to use the paperwork in the future, and then we will just adopt the UK system that no more paper documents to be utilized. Otherwise, like you were gonna be online. So at least the accuracy of the information and the repetition of the process and the costs will help the IENs here in Canada. And also we do also our own NNASC information session with our educators here in IFCNA. And I'm so thankful also for the support granted to me by Dr. Ruth Lee and Miss Abigail Rolla and Bessie for giving us this information session for IENs, specifically the Filipino IEN here in Canada. So language requirements. So the meeting scores was a source of frustration for many applicants as it often took multiple tries to successfully pass the test. But this one, I'm very thankful that because College of Nurses of Ontario are very, helpful to update us and give us the other alternative, um, like doing the SPEP or the supervised practice experience program, and giving us also the opportunity for IENs for those who have been working in a healthcare related work or like employer for 2 years, so they can help them with the language proficiency and help them to comply with the language requirements. And the nursing registration cost, this is one of the very frustrations of Filipino IENs, because we came here in Canada with some like pocket money, and we have to do some survival jobs. I myself also am a good example and a living testimony to this nursing registration cost, that I have did some like survival jobs like PSWs, housekeeping, in order to meet the ends and to help to support my family at the same time, um, to comply and to pay for this documents. And it more or less like 2,250 at that time. I'm okay, like I can do like triple job, but for me, because my goal is to pass or to get my license, but it's all worth it, I tell you. Filipino IENs and or other IENs in Canada, it's all worth it. Like if you know like your goal in life and your goal here in Canada, why you came here, it all like when you surpass and pass all the barriers, I tell you, it's all worth it. Then the nursing registration exam, the final step in the registration process require IEN to pass the next generation NCLEX RN examination. On an average, over half of IEN pass the exam on the first attempt, and few IEN make multiple attempts, and it causes some frustrations as well. So I wanted to see this data that there are IENs like most or like half of the IEN who try the nursing registration exam, half of them only pass. So this also causes like frustrations for some IENs. But I've been telling them a never give up attitude would lead you to success, and the perseverance that you put in your mind that will lead you to your success. So never give up. Just find an inspiration and motivation for you um, to succeed here in Canada. So what are we do, what are you, do we usually do like in IFCNA? So we do mentorship, and we see a lot of like IENs supporting these initiatives. There's a lot of like attendees and participants like attending this mentorship program, and we also collaborate with other organizations to help us to give us the free learning opportunities for IENs for them like to be able to pass the exam and to have the knowledge and skills in for them to integrate effectively in Canadian healthcare system. So, what are the role of the peer mentorship in IEN's career development? So peer mentoring, this is like the very like thing that I want to emphasize. Peer mentoring is a form of learning development that involves people who share similar experiences, roles, and goals. So I think it's better to like IEN helping other IENs, um, to lead and to give an example and to help them navigate the nursing registration process. So I think it's very beneficial if someone is like mentoring you, who like an IEN themselves, like who struggles a lot, but they transform that struggle into success, and now they're here to inspire and motivate others. It's also a good a good provision of safe and supportive environment to learn from someone who understands their challenge, need, and aspiration. Mentoring also foster a sense of belonging, collaboration, and mutual support among peers, and create a culture of continuous learning and improvement. So the role of peer mentorship, it guides you to your career pathway. As I told you, for those seasoned nurse or veteran nurse, like who are also IEN themselves, like will help you guide your career pathways. Building a meaningful connections, like help you to grow and meet other people to get the connections and lead you to success, and fostering personal growth. This for like a role of peer mentorship, it helps a lot for like an individual or like an IEN to find like a way to grow and to help those like those barriers and challenges, uh, help them to succeed and grow personally and professionally. And it's also hard to navigate the challenges alone. So it is better like to find someone, or especially to find a mentor to help you navigate those challenges together. And cultivating resilience, it's not only like bouncing back, like it's also to help and to use those challenges and barriers to help you to propel to your success. So it's better to have like a mentors like who always been who are like willing to be there and to help you to cultivate the resilience that you need in order for you to succeed here in Canada, and most especially to empower IEN through knowledge sharing, because the most important thing is you share your knowledge, and at the same time you empower all IENs for them to succeed and to help achieve their license here in Canada. So here at IMC, I've just been telling you that mentorship is very beneficial to all IEN members. And we do also job coaching and mock interview for those like IENs who are like with low esteem. So the goal of like this job interview coaching and mock interview is to boost their confidence for them. So these like IENs also helping IENs. Now this like we invited some coaches to help us to do their job interview, and I myself also like do the job coaching and for their interview. Some of them like were gonna like message me and help asking for help on how to do their job interview. So it is very important, like you share your knowledge, your experience being interviewed before, and it's very beneficial. And also with the help of Dr. Edward Cruz and other educators to empower internationally educated nurses with the knowledge to succeed in Canada. So the usually we do yearly sharing of information, especially the nursing in Ontario, because I believe that this IENs need to be oriented in the culture here in Canada and like the nursing practices here in Canada. The importance of partnership and collaboration. So we tackled about the importance of peer mentorship. Um, I want you to discuss. I want you to know that the importance of collaboration and partnership help us the Integrated Filipino Canadian Nurses Association to achieve our goal of in helping the IENs to achieve their license. So the importance of partnership and collaboration. Every member of team has a different skills and expertise and talents, and we believe that working together, like we can help achieve our goal in helping the IENs. And when all the members collaborate together, they are able to utilize experience, knowledge, and skills of everyone involved to achieve the shared goal. So the importance of partnership. So I'm very thankful for like the partnerships and collaboration with Care Center and other organizations, like who helped me to provide IENs with the necessary learning opportunities and trainings. So when we work together, we achieve our common goals, and our teamwork is very, very important for us. Teamwork will lead us to success. And we, with this with partnership and collaboration, we like plan like a better programs. So to the help of in partnership with CARE, and thank you to Dr. Ruth Lee, the Philippine government headed by our Consul General Angelica Escalona and Dr. Edward Cruz, and members of the College of Nurses in Ontario. So I myself like think I'm motivated to create plans and to find the strategies that will empower IENs. So from the time I took this position as a president, a lot of like offers to do their learning, to do their webinars and help the IENs. So I'm very, very fortunate and lucky to have this partnership and collaboration in order to provide IENs a better opportunity and the maximize cost of savings. So partnership and collaboration, we usually find sponsors. So some, if we have like events and we find so like a lot of like people like willing and interested to help us to do our projects and initiatives, and also to improve our efficiency. So with this kind of this webinar that we usually conduct in IFCNA, um, with improved efficiency, we are more efficient now when it comes to the needs of the IENs, especially in transitioning into Canadian healthcare system, and to give them knowledge about related to their professional practice in Canada, specifically in Ontario, to help them to adapt and to integrate effectively and successfully into the Canadian health workforce. And enhanced services. So in partnership and some of like members in the community, especially the Catholic Society in York region, also supported like our organization in finding IENs and refer them for those IENs, especially those live-in caregivers and home support workers. They usually refer to IFCNA, and then IFCNA are trying our best to refer them to care center, and also for us to provide them the learning opportunities and skills that they need in order for them to succeed and achieve their nursing registration and increase credibility. To increase our reputation, so like care centers have all been there and known for like excellence in providing assistance in for IEN. So we're very fortunate that care center is supporting IFCNA. We're very thankful and grateful for all the support that a care center is providing us from the time like I asked for support and until now. I'm very fortunate and grateful to Dr. Ruth and the team of Care Center. And this is the upcoming event. Oh, sorry. Just want to share the upcoming events, the strategy that I think that would benefit the IENs, because I find it some of the IENs with low esteem and self-confidence. So by bringing back the basic to enhance the nursing practice. So I gathered all IENs who are successful now and then asked them to help me to find a strategy to empower all the IENs, to at least to bring the basics, because all of like the IENs have their own experience before, but they need to boost their confidence and their morale. So I think this event will finally boost their confidence and enhance the nursing practice. And these are the success stories of like members who were able to get their license, and some of them are very thankful. We have, because they have the community of support and people that would definitely help them to gain and achieve their success here in Canada. And these IENs are now mentors to those new IENs in Canada. So it's, you can see the Bayanihan spirit and the Bayanihan culture. Before they were once like us, like IEN struggles with their journey here in Canada, and now they are mentors and themselves. Because I believe if you mentor one or two or three IENs, will definitely change their lives, and you can definitely shape the future of IENs and the IEN community. So with this kind of Bayanihan culture, we are empowering IENs to do the same and to help and inspire and motivate other people, and especially the IENs. So these are my references. And thank you so much for this opportunity. Thank you, Care Center, for giving this opportunity to give us like as IAP CNA. Let's stop this one. So I'm very thankful and grateful, Dr. Ruth Lee and Rola, Bessie, and Dr. Edward Cruz has all been supportive to IFCNA. So this is, I think this is just like empowering. So as an IEN, we have the critical role, or like very important role to shape the future of IENs because of our position as an emerging leader, inspiring others and motivate others. So by this, I can definitely tell you that some people will follow the same to inspire other people. So thank you again to Care Center.
Thank you very, very much, Mark and Edward, those heartwarming messages that you sent to us. I'm very humble by all the stories that you share, and I'm so glad to hear that Care Center can be one of the positive energies injected into that journey of transition into the Canadian workforce, as well as integration. I think that's the most important part of it, is not just transition, get a first job, but be the shining stars like yourself, Mark, and also Edward, who is now grooming so many more. And as said, Care Center, IEN success is our success. That's our motto. And that's what all of us here have the privilege to serve all the IENs. And for OD like me, it's selfish reasons, as I said, because I need a nurse to look after me, probably earlier than most of you heading into the aging process. So it's very important that we empower all the nurses, as nursing leader of the land and province said, but also making sure that we as Canadians, so lucky to have the talent of IEN come to this land, that we owe it to them, not to support them to the best we can and welcome them into the nursing community of Canada. So I know that we are just running a little short time, but I'm sure that if you can send your questions our way to Mark and Edward, or any one of us, we'd be very happy to respond to you. I see that we have 8 questions there, and I think those questions will not be fair if we just answer it here because we don't have sufficient time and it's quite individualized. So Bessie, I count on you perhaps to respond or get the right people to respond to those questions. And as I said, for those of you who would like to ask more questions, just send it to the Care Center social media website. We also have an email. If you go to our website, you'll find them. I also like to mention the importance of mentorship, and Rola, our program manager, who have published a chapter in the book, about showcasing the care center mentorship programs. And I'm so delighted to hear you, Mark, that you reinforce that message, and then you have peer mentorship. So we do kind of both, because we also know that we need seasoned people. We need people who are very familiar of the Canadian system. Actually, most recently we have the chief nurse of Saskatchewan, Liliana Kennedy, to be one to volunteer her time to be a mentor for our program. So I'm very delighted. And our peer-arrival program, thank you for mentioning that. We also in partnership with the Canadian Nurses Association to provide mentorship to all of our members, both our peer and post-arrival program. So very pleased that we're all heading into the right direction. And when we collaborate, when we join force, together we are stronger. Together we'll make change. Together we will sustain that change. And again, make the whole world know that Canada, we live to our charter. We promise whatever we promise to the world, we keep our promise. So thank you so much again, Edward and Mark, for your words of wisdom. And as Edward pointed out, there's so much work to be done. A lot of work to be done. And we need every single one of you to do that. So on that, I also like to have an early announcement that this coming Friday, the last day of our formal celebration, we will have the first inaugural Mentorship Excellence Award to be presented to one of the nursing mentors that we are so privileged to have. So I'm keeping it quiet now. I just like to have all of you join, and then you will congratulate the winner together. And also for the next 3 days, tomorrow we will have VRPN representation. Norma Tomlin, who is a director now at VRPN, but she used to be a case manager at Care Center, will be presenting. And then RNAO, as I mentioned earlier, we will have the RNAO president, Dr. Claudette Holloway, present as well on racism, and also the RNAO Wednesday and Thursday. I really like to have folks who are in Ontario to take the opportunity to participate on a hybrid presentation by VHA Home Care. This is a movement now that a lot of the patients will be looked after at the home, and VHA is one of the leaders in home care, been around for a long time, and they are very generous that they will host an in-person meeting as well as a webinar like what we're doing now. And they will provide a session that you can actually see the technology. I know IENs are very passionate about technology. You will see what technology we used in home care. It's more high-tech than you ever imagined. So I encourage, we still have some spots. So please, for those folks who in particular in GTA or GGTA or even Ontario, it's not till 2 o'clock in the afternoon, so that you can actually travel if you so desire. Get in touch with Bessie or just send us a line and we'll be in touch for this coming Thursday. And unfortunately, we will have our members first, but we will have room. We welcome others as well. I see that Rola have her hand up, so I turn the mic to Rola, and we can wrap up the session for this morning.
Actually, we share the same thoughts. Thank you, Ruth, for mentioning about the week schedule and about the mentoring as well. So thank you so much, Mark and Dr. Edward. It's always a pleasure to collaborate together. And I'm looking forward to find the opportunities and how to ensure that mentorship has actually kind of serving the purpose that we're looking for the IENs, including myself as an IEN who went through the journey. I owe it all to Care Center. Being a member back in 2010, and actually now celebrating the success and shaping the future and making the difference in the life of other IENs. So definitely we're gonna have more actually work together, Mark and Dr. Edward, and looking forward for everyone to join for all the kind of informative and very, very, I would say, precious information that's gonna be shared during this week, and also to join the celebration of the mentorship. Thank you.
So I'd like to thank all the attendees who take the time to join in our celebration this morning. Thank you very much. And this session has been recorded. So for those colleagues, friends, and supporters who didn't have the chance to join us this morning, please let them know that this can be provided to them or get on our website or social media, so that I know the nurses all work shift work, right? Not everybody can be here with us. So for those of you who stay with us for the entire session, I thank you, and I look forward to you and your colleagues and friends to join us in the next 4 days. Thank you so much. So Bessie, anything else you'd like to say before we wrap up?
Always very, very inspiring and motivating. I'm very, very proud to be a member of this team always. And amazing work both to Dr. Edward and Mark. It's our privilege. And the Bayani culture, I think we share it too. So we're very happy to be part of that as well. Looking forward to the next session following tomorrow. Thank you everyone for joining. Bye for now.
Thank you so much. Thank you.
Thank you very much, everyone.
Thank you.